The topic of my discussion is injection Glucantime. It is basically available by the name of the Meglumine. In the range of strength is 1.5 gram per 5 ml. Now, the mechanism of action is basically it is inhibition of the phosphofructokinase activity, which leads to the prevention of the phosphorylation of the fructose 6 phosphate into fructose 1,6 phosphate. Due to this, there is a decreased parasitic aldolase activity, and there is a which in turn leads to decreased glycolysis, and in turn it leads to the death of the parasite. But this mechanism actually occurs in the parasites, but do not occur in the humans. What are the indications? It is basically used for the leishmaniasis in either form, either cutaneous, mucocutaneous, diffuse cutaneous, or post-Kala-Azar leishmaniasis. Investigations to do is we have to for the CBC, LFTs, RFTs, serum MLAs, and ECG at the baseline, and then repeat after 10 days. They can be given in both forms, either intralesional or in the systemic forms, IV and IM. For the indications for the systemic Glucantime is the lesion is greater than 4 centimeter. There are multiple lesions, delicate localization, for example, in the eyelids, lips, nose, ears, or joints, and there is a lymphatic spread. Previous administration of the topical therapy which failed, or there's immunocompromised and uncontrolled diabetes, infecting leishmania species itself that strongly influence the risk of the mucocutaneous leishmaniasis. If there is overdose of the Glucantime, we have to give with dimercaprol, given as a deep IM injection. It is available as 2.5 mg per kg QID for 2 days, and then BID for 1 day, and then QD for 4 to 10 days. And it is available in the strength of 300 mg per vial for deep IM use. There is suspension is available in peanut oil, mercaprol. Now, the Glucantime is available by the name of the Glucantime 1.5 gram per 5 ml solution, and it contains the Meglumine antimoniate in the form of 0.045 gram of antimony is present in the 5 ml of oil. We have to give it either as an intralesional. In the intralesional, we have to inject 1 to 3 ml at the base of the lesion and repeat once or twice if there is any visible improvement at intervals of 1 to 2 days. And for the systemic, it is we can give in the either the IM or the IV. In case of the IM, 20 mg per kg per day of the antimony, and at least for 4 weeks for the leishmaniasis brasiliensis, and for several months for the leishmania amazoniensis. This is a technique for how we can give in the form of the intralesional. First, we have to take in the syringe, and then we give in intralesionally, perilesionally, and we have to wait for the blood formation. Now, how do we calculate the dose of the Glucantime? For example, we have to calculate in the 80 kg man. For the one ampule of the Glucantime is equal to 1.5 gram of meglumine. And as I've already told that it has contained 0.450 mg of the antimony. So in the 5 ml, it has 405 mg of the pentavalent antimony, and if to have to calculate for 1 ml, 405 divided by 5, we have get 81 mg of the pentavalent antimony in the 1 ml of the Glucantime. Now we have to calculate the dose in 80 kilogram person, and we have to give it the 20 mg per kg per body weight. If we have to calculate in 80 kilogram man, we have to multiply it by 20, and then we got it we've seen that the 81 mg of the pentavalent antimony is equal to 1 ml of Glucantime, and 1600 is equal to, we have to divide it, and we got 20 ml. So 20 ml of Glucantime means 4 ampules of Glucantime has to be given in 80 kg men. And what are the contraindications for systemic antimoniasis is patient's age is greater than 50, any significant heart, liver, or kidney disease, and in pregnancy. These are the same, the routes of administration. So thank you.